next up, I have Dr. Conor Kerley. He is a senior dietitian and clinical research specialist for the nonprofit group called Physicians Committee for Responsible Medicine in Washington, D.C. Dr. Kerley has a particular interest in cardiovascular disease prevention and treatment, and especially hypertension and heart failure. He earned his PhD at the University College Dublin, also has a Bachelor of Science in Human Nutrition and Dietetics from Trinity College in Dublin. For the past year or so, Conor has served as a postdoctoral clinician and researcher with MedX Wellness Program and with Heartbeat Trust, and he's going to be presenting at the international conference that's coming up, International Conference on Nutrition in Medicine in Washington, D.C., July 28th and 29th, along with 18 other experts. And he's taken some time today to speak with us. Thank you so much, Dr. Kerley.
Thanks for having me.
Hey, that's great. And you mentioned that you're in Washington on a 3-year work visa. How's that going so far?
Yeah, excellent. Just arrived about a month ago, so brand new, lots of learning, but so far so good, and I'm loving America.
Well, and you're involved with the Physicians Committee for Responsible Medicine. One nice thing about the human body is it's pretty much the same anywhere you go. So how did you get involved with this particular group?
You spoke about the conference, the International Conference of Nutrition and Medicine. So I attended that conference this time last year in July 2016. And I was really impressed with how it was organized and the information that was disseminated. So from there we had some discussions, and I decided to come over.
So for people who don't know the PCRM and these conferences and all the work that they're doing, do you want to talk a little bit about that?
Sure. So the Physicians Committee of Responsible Medicine, or as you say, PCRM for short, is an international non-profit organisation based here in DC. And we really help people throughout the world to reduce their risk of chronic disease with a nutrient-dense plant-based diet. So we target multiple disorders, for example, cardiovascular disease, including high blood pressure, cancers, type 2 diabetes, obesity, and so on and so forth. PCRM was founded in 1985 by Dr. Neil Bernard, who is actually a graduate local here from George Washington University School of Medicine. And he really envisaged a small group, but over the last kind of 22 years or so, PCRM has gone from strength to strength, and we now have over 15,000 physicians worldwide, all of whom work on a common goal, which, as I say, is to reduce the risk of chronic disease with this nutrient-packed, nutrient-dense, plant-based diet.
15,000, that's a lot. And so I think one thing that I've heard people like Dr. Michael Greger have said, you know, when people ask him, why doesn't my doctor tell me about nutrition and how it can help me? And his answer is, well, doctors don't learn about nutrition. Now, it sounds like you studied that, but separately in Ireland. Is that right?
Yeah, so Dr. Greger is completely right. Most physicians have very little, if any, formal training regarding nutrition, but nutrition is so important, and I think everybody knows this, including physicians, but physicians generally don't get trained, and oftentimes will not have the time in their busy schedule to read about nutrition and also to counsel their patients on the importance of nutrition. And that's really why I went down this path. I think we have enough people prescribing medications, but we don't have enough people prescribing a healthy diet. And I think it is so important, and I think the research really emphasizes that point.
Mm-hmm. Yeah, the research seems to be increasingly supporting the plant-based lifestyle. And on your Twitter, you mentioned that you're motivated by evidence over tradition/opinion.
Yeah.
Do you want to talk about that?
Yeah, absolutely. I mean, I suppose, nutrition is a very young science. It's been around for less than 100 years, and not a lot of people know that. So we're still finding a lot of things out. And, for example, when nutrition was first discovered, it was thought that vitamins would cure every possible problem known to man. And obviously that has not panned out. Vitamins stop vitamin deficiencies, but they certainly do not cure, for example, heart disease or cancer. However, some of the early guidelines are still deeply rooted in people's, even healthcare professionals' opinions, and that is echoed by their public health messages. And a simple example is the 5 portions of fruits and vegetables per day. That really we know that 5 is probably the minimum that people should go for, and that more is probably better, maybe around 8 or 9. And also, research, including my own research, has shown that different types of fruits and vegetables are probably superior to some other varieties. For example, green vegetables are probably the best type of vegetables. So, for example, cabbage, kale, cauliflower, broccoli, arugula, things like that are probably going to be a lot better than, for example, a white potato. And similarly, things like berries, strawberries, blackberries, blueberries are probably going to have a lot more nutrients than, for example, a banana. And that's not to say that potatoes or bananas aren't healthy, but if we base our diet around 5 portions of potatoes and bananas versus 10 portions of green vegetables and berries, we're not going to get the same health benefits. But even to this day, in international guidelines, we hear all the time 5 portions of fruits and vegetables. And what happens then, unfortunately, is, the vast majority of the population, they kind of aim for maybe 4 or 5 portions, and they may get it some days they may not. Whereas if we advise 10 portions, then maybe some people would increase to 6, 7, 8, 9, or even 10 portions per day, and we would expect to see major health benefits on a population basis based on that.
Well,
and I suppose the important thing about science is we're constantly learning, we're constantly, there's constantly new advances in the field, and it's my job and the job of healthcare professionals to keep afoot of these new discoveries and to build that into my own practice and to what I tell individuals and on a public health level, and that's the difference between a qualified healthcare professional and someone who doesn't keep up with the literature.
Yeah, right, and there is a ton of it, and it seems that what's being revealed is that we can get everything we need from a plant-based diet, and as you mentioned, a variety of different colors, and so there's really no reason to eat meat and dairy, and in fact, that can be very detrimental to our heart.
Absolutely. Well, I think the first thing to say is that there is one nutrient that a plant-based diet will lack, and that is vitamin B12, right. Which is actually not made by plants, but it's also not made by animals. It's made by bacteria. So anybody considering following a plant-based, a vegetarian or a vegan diet needs to be extra cautious with their vitamin B12. But this can be found in fortified foods and in a general supplement, and there's absolutely no harm in taking a supplement. Mm-hmm. It's not going to build up in our body or anything like that. But regarding other nutrients, absolutely, you're 100% correct that a well-designed, varied plant-based diet can provide all other nutrients in optimal amounts, which may be key for disease prevention and treatment. I have a major interest in vitamin D. As well, and vitamin D is quite difficult to get on a plant-based diet, but it's actually quite difficult to get in diet in general, even if somebody eats a lot of dairy and fish and meat. So what I recommend is some sensible sun exposure when we have it, and I always call it Kerley's rule. So when you're out in the sun, you want to have your body, your shadow, you want your shadow to be shorter than your body.
Okay.
So, for example, if you go out at 7 p.m. in the evening time, when the sun is quite low in the sky, your shadow will be quite long, and this means you're not making any vitamin D. But if you go out around 11 a.m. noon time and you look at your shadow, it's going to be quite short, and this means the sun's high in the sky, and you're going to be making vitamin D. So I recommend maybe 10, 15 minutes of sun exposure to get enough vitamin D. Oh,
that's not a lot. That's good, because you don't want to get too much UV rays at that time of day, right?
Absolutely. It's really important to understand that some things are beneficial, but it can be, too much can be detrimental as well, and this is certainly true for something like sunshine.
Okay, I take a vitamin D supplement that's made from mushrooms.
Yeah. So the problem is mushrooms make vitamin D similar to what humans do, so it's only mushrooms that are exposed to ultraviolet B radiation or to sunshine that have vitamin D. So general mushrooms do not have any vitamin D. So absolutely, you're correct. You can buy mushrooms in the stores which have been irradiated, and they do contain vitamin D, or you can buy a supplement which is derived from mushrooms. And that's fine, but just not to rely on store-bought mushrooms for vitamin D, especially in the wintertime.
Well, and we live in a rainforest, so we celebrate when it rains. Some of us celebrate when it rains, because if it doesn't rain in the rainforest, then we're not living in a rainforest anymore.
Yeah.
And you're from Ireland, you know what rain is about.
Absolutely.
So what do we do? I mean, I guess in the winter it's necessary to take a supplement, but when the sun does come out, you're saying just 10 to 15 minutes around noon, and over more of our body, right, is better than...
Absolutely. So again, another thing that I speak about as well as the shadow is try to expose more skin for less time as opposed to less skin for more time. In other words, instead of saying, okay, I'll go out and expose my face and my hands for an hour, why don't I go out for 10 minutes in a bathing suit, something like that, because that's going to minimise your risk of sun damage. However, if for some reason somebody needs to avoid the sun, or as you say, lives in a rainforest or in Ireland where we don't get much sun, I do recommend a supplement, and I recommend a supplement on a daily basis with food, and I think a reasonable dose is about 1,000 units, which is 25 micrograms per day, with meals. However, if anybody has any concerns, your primary care physician can measure your level quite easily, just in a standard blood test. Right. And I would also recommend that.
Okay, yes, and luckily in Canada we can go to our doctor and request that, and it doesn't cost us anything, so we might as well do that while we still can.
Yeah, absolutely.
Okay, so now you've done a lot of research, and you're going to be speaking about the plant-based diet benefits for healthy hearts, and but you've also you've looked at the research a lot for multiple sclerosis, and you find similar results, is that right?
Yeah, so multiple sclerosis is an autoimmune disease where the immune system of the body attacks the central nervous system, so the spinal cord and the brain. So what could that possibly have to do with diet? But from my reading of the literature, there is a huge impact of diet on multiple sclerosis rates and also on multiple sclerosis incidence. The amount of multiple sclerosis cases that occur. And my interest in multiple sclerosis started way back in 2003 when I myself was diagnosed with multiple sclerosis at the age of 15. So that's quite a while ago now, but I did not get any medical or nutritional advice regarding lifestyle, and I just thought that this was crazy. How could it not be connected in some way? And I got no support from anybody except my family, but I started reading like crazy, and I read a lot of things which probably were not good scientific sources, but then as I went to university and started learning more and more, I got to know a lot of that literature, and it does seem that diet does have a major impact on brain health, including multiple sclerosis, which again is really, really empowering. But again, unfortunately, a lot of people with autoimmune diseases like type 1 diabetes or rheumatoid arthritis or multiple sclerosis are not given any dietary advice regarding controlling their disease.
And so, how have you noticed? Have you got your situation under control?
Yeah. So basically, when I was first diagnosed, I had 3 relapses in 8 months. And the first relapse was on my left-hand side, so I had like almost complete paralysis of my left arm and leg. Wow. And then a couple of months later, I went into my head, my face. And I had paralysis there, and the doctors couldn't figure out what was going on. And then a couple of months later, I had right-sided paralysis. And then after all the tests, the MRI scans, the CT scans, the lumbar punctures, I finally got the diagnosis, and it was a very confusing time for me and my family, but my attitude was to just find out as much as I could, because I was not getting this advice. So for me, I had those 3 relapses, and then I was diagnosed, and since then I have not had a single issue. Wow. And I have no symptoms today.
What? That's amazing.
I think that lifestyle is absolutely crucially important.
Wow. Yeah, you mentioned I looked at a video where you were talking about MS, and you say genetics are not our fate.
Yeah, I mean, I think that's one of my favorite slides that I've ever presented anywhere, because, people say, oh, but my mum, my mother, my father, they had heart disease and died, or they had multiple sclerosis, or they were obese or something like that. So I'm just doomed. So you know what? I'm going to sit in the corner and eat my bag of chips and some ice cream and wait for genetics to take place. But we know this is simply not true, that the vast majority of major chronic diseases, so I'm talking about heart disease, I'm talking about cancer, type 2 diabetes, obesity, genes play a minor role. It's not that they're not important, it's that the major important factors are environmental. So in other words, if you exercise, what sort of food you eat, your sleeping habits, your stress habits, things like this. And what's really, really empowering is that the individual themselves, they have the power to change this for good or for bad. Now, at the same time, it is important to understand that there are some diseases which are very much genetic, and examples of those diseases would be something like cystic fibrosis or Down syndrome. And unfortunately, in those diseases, if you get the gene, you're going to get the disease. But as I say, the vast majority of diseases which, kill most Americans and most people worldwide, are not genetic diseases. And again, genes do play a role, but it's a minor role, and lifestyle, particularly nutrition, seems to be really, really important for the treatment, prevention, and in some cases even the reversal of these diseases.
Yes, that's the amazing part, I think, from what I understand, is how plants will actually just go in and clean everything out. Yeah. And
go ahead. Yeah. It is really amazing to see the effects, and the effects are so broad-reaching that it's not like the sort of lifestyle can impact on heart disease only. It can have an effect on diabetes, it can have an effect on blood pressure, it can have an effect on cancer, and it can have an effect on body weight or obesity as well. So really, we're looking at treating the causes as opposed to treating the symptoms. And again, that's really, really empowering.
It really is. We have a lot of power. And I heard it said that the genetics is kind of like a light switch. So you have this light switch. Now, if you eat the wrong foods, then you're going to turn on that light switch, but you don't have to flick it on. It can just be part of your genetic makeup that never is activated.
Yeah, absolutely. And the other way which is often described, it's just like genetics load the gun, but lifestyle pull the trigger. So really, we're born with a set of genes, and those genes are with us for our lives, but our lifestyle can determine how those genes are expressed. In other words, what effects they will have. And again, that's really, really powerful. And that's kind of spawned a new era in science called epigenetics. So in other words, what we can do to modify the genes that we already have. So again, someone may have the genes, and there was some recent research in the New England Journal of Medicine looking at cardiovascular disease, so the biggest journal in the world looking at the biggest killer in the world, which showed that people who had a genetically higher risk of heart disease, if they modified their lifestyle, they had a 50% decreased risk of having heart disease.
Wow!
Just by modifying their lifestyle, and these are the people with the worst of the worst genes. Wow. So most people don't fall into that category. Right. And again, this is really, really empowering.
It really is, and so there's lots more that we can learn, and thank you so much for introducing us to this today. And you're going to be speaking at the Conference on Nutrition in Medicine in Washington, D.C., July 28th, 29th, and that's a place, along with 18 other professionals, I believe, and that's a place where doctors and nutritionists can go and learn from others and network and that sort of thing. So
yeah, absolutely. It's really a conference targeting healthcare professionals. So it will be heavily attended by physicians, but also by dietitians, by nurses, and by physiotherapists and health coaches and other healthcare professionals like nurses. And really, it's a great place to learn some new information. The focus is on a dynamic program, looking at practicalities as well as just information. And it's a great place to learn up-to-date science, but also, as you say, to network.
Right. Oh, thank you so much for taking the time today, Conor. We really
thanks for having me.
All right, we'll chat again. Thank you.
Thank you.
Okay, bye-bye.
Take care.